Tired of constant ringing in your ear? Before adding more treatments, let's talk about what medications can give you tinnitus and what to avoid. Welcome back to Kundlas MD. My name is Dr. Kulmeet Kundlas and I'm a primary care physician for 27 years. Today we will break down what are the common medications which can give you tinnitus or make it worse. And if you have tinnitus, you know how hard it is to take care of it and how to live with it. I want you to pay attention to the categories of different medications which you might be on and may be contributing to your tinnitus. I'm not saying you cannot take these medications, but I want you to be careful. Number one on the list is anti-inflammatory medications and analgesics. Anti-inflammatory medications like ibuprofen, aspirin, naproxen, all those anti-inflammatory medications are directly ototoxic and they can give you ringing in the ear and they could lead to worsening of your tinnitus. If you have tinnitus, consult your doctor and do not take these medications without talking to your physician. Aminoglycosides are a kind of antibiotics. You might have heard the name of gentamicin, tobramycin. These are very good antibiotics, and many times if you have life-threatening infections, we may have to use them. But if you had any of these medications, they can contribute to tinnitus. If, God forbid, you need antibiotic, make sure you talk to your physician that if they could avoid these medications, that will help. Diuretics. These tend to be ignored the most. In our society, diuretics are part of multiple treatment plans, whether it's congestive heart failure, edema, hypertension. These loop diuretics, we could call it stronger diuretics, furosemide, bumetanide, all of these can give you or make your tinnitus worse. If you are suffering from tinnitus and you have one of these diagnoses, make sure you talk to your physician and let them know that you have a tinnitus. Chemotherapeutic agent. If unfortunately you are on one of the chemotherapy medications which can give you tinnitus, talk to your oncologist, make a shared decision. Antidepressants, especially from the class SSRIs, the most common in this category are Zoloft, citalopram, Paxil. All of them can make your tinnitus worse. Sometimes, paradoxically, if your tinnitus makes you depressed, we may have to use this medication to help you with the depression. But I want you to be careful. If you are on antidepressants and you have tinnitus, talk to your physician. Let us look for alternative antidepressant class. Hypertension medications, beta blockers, and ACE inhibitors. You might have heard the name atenolol, metoprolol, lisinopril. All these medications can make your tinnitus worse, and you must be careful about if you have tinnitus. Benzodiazepines. Lot of seniors and young, when they have difficulty in managing and coping up with stresses of life, they start taking anti-anxiety medication which fall under the category of benzodiazepines. These medications can make your tinnitus worse. My goal in this video is to provide you with simpler tools that if you're taking pain medication, blood pressure medication, anti-anxiety medication, antidepressants, or you are on chemotherapeutic agents, or you require antibiotic, all these classes of medication can either give you tinnitus or make the things worse. I want you to be cognizant of it and careful about it. Thank you very much for joining me in this video. We will put the complete list on tinnitus in the cards. Like, share, and comment, and I will see you next video.